Bacillus anthracis, the bacterium responsible for anthrax, is a gram-positive, rod-shaped organism that appears in chains resembling bamboo sticks. Under the microscope, it forms large, boxcar-shaped rods, and in culture, it produces non-hemolytic colonies with a ground glass appearance on sheep blood agar. This pathogen is non-motile, catalase-positive, and uniquely susceptible to penicillin. On various agar media, Bacillus anthracis exhibits distinct characteristics. It does not grow on MacConkey agar, lacks motility, and produces lecithinus. Unlike most Bacillus species, it forms a robust capsule when incubated in conditions favoring virulence expression. More advanced identification methods include polymerase chain reaction, or PCR, which detects the PXO1 and PXO2 virulence plasmids, and matrix-assisted laser desorption ionization time of flight, or MALDI-TOF mass spectrometry, which provides rapid and precise microbial identification. Clinically, anthrax presents in three forms: cutaneous, inhalational, and gastrointestinal. Cutaneous anthrax, the most common form, begins with a painless skin lesion that progresses to an ulcer with a black necrotic eschar. Inhalational anthrax initially mimics flu-like symptoms but rapidly deteriorates into severe respiratory distress and shock. Gastrointestinal anthrax, caused by ingestion of contaminated meat, results in severe abdominal pain, vomiting, and bloody diarrhea. Early and aggressive treatment is crucial. First-line antibiotics include ciprofloxacin and doxycycline, both of which are effective against Bacillus anthracis. In systemic infections, combination therapy with additional agents such as rifampin, vancomycin, or penicillin is recommended. Because anthrax spores can persist in the body, antibiotic therapy must be continued for 60 days to ensure complete eradication. Understanding Bacillus anthracis is critical for medical professionals handling infectious diseases. Its unique microbiological characteristics, clinical impact, and treatment strategies make it a pathogen of great concern. Always follow established protocols for diagnosis and management. This content is for educational purposes only and should not be used as a substitute for professional medical advice. For more expert-led lectures on infectious diseases, microbiology, and medical science, subscribe to our channel and stay informed.